25th, 1992.
Okay. And why are you here today?
Appendicitis.
Do you know where you are?
IMC Hospital.
IMC Hospital. Mr. Garfunkel is alert and oriented to time, person, place, and situation. All right, Mr. Garfunkel. Can you tell me a little bit about the pain that you're having associated with your appendix?
Sharp pain right here.
When was the onset of the pain?
Yesterday at 3 p.m.
Oh my gosh, Mr. Garfunkel, I just noticed this blanket is like suffocating your head. How's that? Does that feel better?
Yeah.
Are you able to breathe now?
Yes.
We'll have to be careful for health hazards like blankets over the head. All the rest of the cords are plugged in. Everything else looks great. There's nothing coming out of the biohazard box. Okay, so back to the appendicitis. When did the appendicitis start?
Yesterday.
Yesterday? About what time?
3.
And what would you rate your pain on a scale from 1 to 10, 1 being the least pain and 10 being the worst pain possible?
5. I just had some pain medications.
Okay. Okay. Is there anything that makes the pain worse?
Sitting up.
Sitting up? Is there anything that makes it better?
Laying down.
Laying down? Okay. Are you worried at all about how this is going to affect your activities of daily living?
Well, I haven't been able to work the past 2 days, but I think after I get some surgery, then I'll be fine.
I agree. I think, Mr. Garfunkel, you're in good hands here at IMC Hospital. Can you tell me at all, have the doctors explained to you what appendicitis is, what kind of surgeries they do to cure appendicitis?
I think I'm getting an
Appendectomy. Yeah, an appendectomy is surgical removal of your appendix. It's a wonderful surgery. You'll be fine and out within a couple days. We'll all go great. I can almost guarantee it. I've seen many appendectomies. How about your emotional needs? Have you had any emotional problems since you've been here? Any changes in your typical emotional functioning?
No, I think I'll be fine. I have a really good family support system.
I'm sure. I saw them in the hallway. I'm going to take a quick look. We're going to do a little head-to-toe assessment since it's the beginning of the day and I have never met you before. There's no lumps or bruises. Your hair looks quite beautiful and well manicured. Okay, so I want to take a look at your eyes. Look straight. Oh, your pupils are constricting. Do it on this side. Now I'm going to do it again, and I'm going to look at the opposite eye. The pupils are still constricting on the other side, which is a great sign. Perla, pupils equally reacted to light in accommodation. All right. Look at your ears. I see no drainage or discharge or swelling or puffiness, which is great. Your nose, nothing unusual, no discharge, draining. Open up your mouth wide and say ah. Ah. Great. Teeth are intact and straight. Open up your tongue. Pink, moist, oral mucosa is pink and moist also. Okay, that looks great. Can you tell me where you hear this noise? Great, hearing is well intact on both left and right ears. Your skin is pink and it's dry. No tenting is present. Wonderful. Now, hold on to, squeeze as hard as you can. Great. Equally strong bilaterally. All right, your radial pulses, they're equal bilaterally, and I'd rate them as a 2, which is a normal finding. Okay. Now, Mr. Garfunkel, I'm going to take a little look at your heart sounds, and I'm going to look under your shirt for a second. This is the apex of the heart. It's at the second intercostal space, left sternal border. And I'm listening for a minute. And then I'm going to listen for 10 seconds with the bell of the stethoscope. Now I'm going to look at the base of the heart at the the third intercostal space, the Erb's point, also known as the point of maximum impulse. Great. Heart sounds are of normal rate and rhythm, about 80 per minute. Okay, Mr. Garfunkel, I know you have some lower right abdominal pain, but I need you to get up and so I can listen to your lung sounds. Do you mind if we put this here and you hold it over to split the incisional area, or where they're going to make the incision?
No, I think I'll be fine.
Okay, I can help you up. 1, 2, 3. Great. Now I'm going to listen to your lungs on the posterior in 6 locations. And I'm going to do 1 location on each side, and I'm going to do 6 locations in the interior of his chest. Now every time I put the diaphragm in the stethoscope, breathe in and breathe out. Great. Okay. I know this might hurt a little bit. Are you okay not splinting for just a second so I can listen to the anterior lung sounds? Alright, Mr. Garfunkel, your lungs are clear in all lobes. Alright. Now, your big toes show capillary refill of less than 3 seconds, which means that blood's getting to your lower extremities. And capillary refill of less than 3 seconds in your arms as well, which is great. And your pedal pulses are palpable. 2+, which is a great normal finding. Not too bounding or not too weak. Okay, now press against as hard as you can. Great bilateral strength. Up. Press up against my hands. Great bilateral strength going upwards. Alright, Mr. Garfunkel. The only thing is I haven't gotten your vital signs yet. Oh wait, look it. Here's the CNA.
Hi. I just took Mr. Garfunkel's vitals. His blood pressure was 128 over 72. His temperature was 101.1, so a little high. His heart rate was 80, and his respiratory rate was 25, and he's 93% on room air. But when I was in here,
That's a little bit low. I'll put a nasal cannula on him if it gets below 93 degrees. Percent.
When I was in here earlier, I forgot to palpate your carotid arteries. Can I do that real fast? Alright. I want to make sure and not do this at the same time.
Oh, thank you. I did forget to do that. She's also a nursing student, in addition to being a CNA.
Alright. Everything looks great.
Alright, Mr. Garfunkel, we'll be in a second to do your full abdominal assessment with another nurse.
Hi, I'm student nurse Elise. I'll be performing a focused abdominal assessment on you today. First, I'd like to start with a few questions. When was your last bowel movement?
Yesterday before lunch.
Is that typically normal for you?
Yeah, I go about the same time every day.
Okay. Have you been having any urinary problems lately?
No, everything's been normal.
Okay, well first I'm going to start by inspecting your abdominal area. Alright, the skin looks pink and it's a little moist because you're having a bit of a fever. There's no blue areas, which could be a sign of bleeding or bruising. So first I'm going to auscultate. I'm going to listen to all 4 quadrants, and there should be 5 to 30 vowel sounds in each quadrant. So 30 seconds, 30 seconds, 30 seconds, 30 seconds. listen to your abdominal aorta with the diaphragm and then the bell. And the bell can usually detect abnormal sounds. So it's right below the explored process. And listen to the bell. Okay. Now I'm going to palpate. I'm going to start with light palpation first. And just let me know if there's any tender spots. That hurt?
Hard to say that.
Okay. And then I'm going to do deep palpation. It's probably from your appendicitis. Okay. So a sign to show that my patient is having appendicitis is I would place my hand right above her kneecap and I'd have you raise your leg. And are you having any pain in your abdominal area? Okay, that's a sign of appendicitis. If my patient was having gallbladder problems, I would do Murphy's Law, which is I would insert my hand right below her ribs and have her inhale, and if my hand moves up and there's tenderness, that's usually a sign of gallbladder problems. So now I'm going to palpate your liver and kidneys. Just let me know if there's any tender spots. Is there any tender spots? No? Okay, that's good. Any tender spots?
No.
Okay. I'm also going to check for rebound tension. So let me know.
Ow.
So rebound tenderness is when I press up, there's pain. So that's a sign of appendicitis in that area too. So now if she had a distended bladder, I would start from the pelvic girdle and I would palpate all the way up. And I could feel for fluid retention, and I could also percuss, starting from the pelvic girdle moving up, and if there was dullness, that's a sign of bladder distension. So now I'm going to have you sit up at the side of the bed, and I'm going to assess for kidney tenderness and kidney problems. So first I'm going to start by palpating, and let me know if there's any problems, or any tenderness. Any tenderness?
No.
Alright, now I'm going to do blunt progression. I'm going to place my hand here and go like this. Does that hurt? No? Okay.
None there either.
Sounds good. And that's it.
Hi, Mr. Garfunkel. I'm Rachel. I'm a student nurse. I'm going to be looking at your genital urinary region. Are you sexually active?
Yes.
Alright. How long have you been sexually active?
Since I was 15.
Okay. How many sexual partners have you had?
I can count them on 2 hands now. So I bet about 6.
Okay. Well, do you always use a condom when you have sex?
Not always.
Okay. Alright. Well, I'm going to examine your testicles and make sure that you don't have any STDs or lesions or masses down there. Alright. Your hair pattern looks good. Alright. Do you ever have any irregular discharge?
No discharge.
Alright. I'm going to move this over to the side. Let me know if you feel any pain. Alright. There's no masses or lesions or distended veins. Alright. None over here either. Alright. That looks good. Alright. I'm going to roll you over and I'm going to look at your back side.
So nurse, if I don't want to use a condom, how can I not get STDs?
There's no guarantee of not getting an STD if you don't use a condom.
How about that birth control stuff?
That does not prevent STDs, but that can help prevent pregnancy.
Okay.
Alright, your skin is intact back here. Are you having any discharge from your anus region? Alright, skin's intact, no redness, swelling, anything like that. Everything looks good.